Ladies and gentlemen, this is quite the arduous task I'm about to undertake. This is my final task for the evening. I have been given, after many years, this slightly painful and mostly dubious honor of presenting something known as the Golden Bedpan Award. Now, the Golden Bedpan is a very, very special award. While the rest of the award recipients this evening set out to work to improve the lives of others, to advance social justice, they distinguish themselves in doing so. The Golden Bedpan was created to honor those who choose to follow a different path. Now, these trailblazers deserve a truly, truly unique form of recognition. So the Healthcare Consumers Board of Directors awards the Golden Bedpan in this year, 2013, to the individual or group of individuals, corporation, or political body that has distinguished itself above all others during the preceding year by its attack on the health and welfare of the people in its community. Now, there were plenty of wonderful choices this year, but we settled on a select number of particularly worthy candidates, and we've chosen to acknowledge each and every state from these great United States that is refusing to make the ridiculously easy decision to expand Medicaid to their citizens under the Affordable Health Care Act. Now, you may be surprised to know that as of today, there are somewhere between 19 and 24 different states that are either flat out refusing to expand Medicaid to their state, or considering alternative plans and have not committed in one way or another. That means that nearly half of the United States, it's heavy, isn't it? Yeah. That means that nearly half of the United States, I've lost my place. That means half of the United States are turning their backs on the millions of uninsured, low-income people of their state and holding them hostage to an ideology and political gain. That's right. Now, look at this map. Yeah, look at the map. I feel like I'm getting a few flashbacks of 2000 Gore v. Bush election. I'm really sorry if anyone is from any of these states. Claudia, Miss Texas. But it is difficult to ignore the sort of large red mass there that takes up most of the South. And then, of course, there's Florida, which is actually, I'll explain in a second, should probably be more of a pinkish color. And there are others like Maine, but, you know, I don't know what's going on in Maine. Anyway, before I get any farther afield, I want to give you a little background. One of the major victories, if not the most influential healthcare reform of our time, is the Medicaid expansion under the Affordable Care Act. And for years, uninsured adults have been excluded from Medicaid coverage, even the poorest of the poor, because they were not a parent of a child, they did not have a disability, or they were under the age of 65. So if you don't have those things, apparently you can't get sick. Healthcare consumers and organizations like ours around the nation had to piece together various forms of assistance and ingenuity to help people, sometimes miraculously, get access to the care that they needed and deserved. In less than 6 months, all of that will change, ladies and gentlemen. Medicaid will be available to anyone and everyone who has an income below 138% of the federal poverty line, or $15,200 a year. No more of these arbitrary, exclusionary Medicaid eligibility criteria that have left millions uninsured, including over 350,000 people here in Illinois alone. If you are low income, you can get Medicaid, simple as that. It's pretty amazing. That is, as long as you don't happen to live in Tennessee or Mississippi or Alaska or Oklahoma or Georgia or Texas. Some of those states have the highest number of uninsured people, and yet these, people turned down an offer from the federal government to pay for 100% of the new Medicaid coverage in their states. Now, I know the governor of Tennessee himself said that he doesn't want to give that even if the federal government is going to pay for it for 3 years. They're going to pay 100% of it for 3 years because he doesn't want to feel bad when he has to take it away from people, and it's better to just never give it to them. How can you begin to explain that? I don't know. Yes, it's food, whatever. He's not here, he's in Tennessee, what's he going to do? Some states refusing the Medicaid expansion say they need a stronger commitment that the federal government will fully fund the Medicaid match before approving an expansion. Okay?
Take government down.
States like Mississippi, South Carolina, Oklahoma have among the lowest Medicaid spending per recipient and repeatedly slash their Medicaid programs, are showing such a strong commitment to their residents. Other states are proposing alternative plans to the federal Medicaid expansion so they have more control and are less reliant on the federal government. Okay, I'm listening. Go. Earlier this week, Florida Senate voted on an alternative proposal to help pay for insurance for people living in poverty by giving them $10 a month to buy private forms of Medicaid. That is really going to help me buy insurance for my family. It would if it were the year 1913. That is why I said that Florida should be a little pink on the map, because they can't seem to figure out that what they want. They can't seem to figure out what they want when the governor leads the U.S. Supreme Court lawsuit against the Affordable Care Act, and then he flips and says he wants to expand Medicaid in Florida after the lawsuit fails, but the legislature says no and comes up with the idea for $10 a month, right? So I have this little fantasy that in some of these states that are holding out for something even better than the Affordable Care Act and the expansion of Medicaid, that they're really holding out for something like single-payer health insurance, or Medicare for all the time, or, I'm sorry, did I check up? What? Okay, that was a dream. So, enough of my bitterness. So, for continuing to reject the Affordable Care Act, a law that all 3 branches of the federal government support and upheld, and for holding the millions of poor, vulnerable, and uninsured of your states hostage just to save political face, we present Champaign County Healthcare Consumers' 36th annual Golden Bedpan Award to all of the states who are refusing the Medicaid expansion.